sphincter is right over here.
So this was the gallbladder here. In case they ask, this would be the cystic, and this one would be the common because you don't see the left and right.
Common which one? Hepatic or bile?
Bile. No, hepatic. This would be the common hepatic. Sorry, guys. And this would be the common hepatic coming out there.
Common bile.
Oh, okay. So common hepatic on the top and common bile on the bottom. That makes sense.
Common hepatic because it's coming from the liver. Common bile because it's now coming from the liver and the gallbladder.
Right. Okay. That makes sense. Cool.
Okay. Plicae circularis right here. Major duodenal papilla right over there. That's one plicae circularis. So one of these folds blown up. Yep.
Oh, wow.
You can see these are the microvilli. They're going to be lining the plicae circularis. There's one villi. I've been talking too long. Villi lining the plicae circularis. There's one villus right over there. You can see the epithelium and the lamina propria. You can see the lacteal. You can see these bumps. That's where the goblet cells would be. And then you can see all of the simple columnar absorptive epithelium in there.
The lacteal was this, right?
The green one. And then on top of the villi, that's where you're going to have the microvilli. So you have the plicae circularis, the villi, and the microvilli all to increase surface area because duodenum, that's where most absorption happens.
Wait, where did you say the microvilli on here?
They're on top of this.
Okay.
They're not on here. I mean, they are, but you can't see them.
Yeah, they're individual.
41.
The green thing, 40 is the lacteal.
40. This is some just blood vessels.
Yeah.
Okay, what about 42? What is 42?
A vein.
Is this a vein?
Yeah.
All right, just want to make sure.
Yeah.
stuff.
It's an artery and a vein.
Okay. And then we have the teeth.
Yeah, can we do
All right.
Oh, the tooth, yeah. The tooth is easy, but we'll go ahead and get it on here.
Alrighty. So we have a crown, and we have a surgical crown, and then we have an anatomical crown. So surgical would be the stuff that you can see above the gum. The anatomical one is everything that's covered by the enamel. So it goes into the gingiva. So this right here would be the anatomical crown.
What's this and what's the...
I'm getting there.
So you said this was the surgical, but
Yep.
all of this would be the anatomical.
Yes.
Okay.
So this right here, 17, is the enamel. It covers the crown. Oh, by the way, between, so this is the root, right? So all of that's the root. So the part right here in the gingiva, between the surgical crown and the root, this is called the neck. All right, so the crown is covered by the enamel, 17. The root is covered by cementum, 18. So you have enamel in the crown, cementum in the root. All right, the bulk of the tooth is made by dentin. So all this yellow right here. This right here would be more of the cementum. This right here would be more of the enamel.
Exactly right.
Inside of the tooth, you have a pulp cavity that contains pulp, and pulp is blood vessels and the nerve. And then you have the root canal. This is the thing that they dig out when you get a root canal. They dig out all the blood vessels and nerves that come out of here. And at the bottom of the tooth, this is the point where all the blood vessels and nerves enter and exit the tooth. So this is called the apical foramen. Yeah. And then so there's your bone, the jawbone, right? The alveolar, not areolar. Alveolar bone, and so you have periodontal ligament, so that's the candy corn looking stuff. Periodontal ligament links the tooth to the bone and also allows, because you can even feel your teeth moving, right? So they're not completely immobile. So yeah, so this serves for like slight mobility and cushioning of the tooth. Because if you did not move it every time you bit down on something hard, then your jaw would take all the force.
Right.
So it's like a shock. It's like the shocks on the car.
Yeah. Yeah, that's true.
That's a periodontal ligament. And that's it.
Perfect.
Over.
If you guys want to see the ovary, here it is. Here's the ovary.
All right, here we got the ovary.
Yeah, go ahead.
Okay, so in an ovary, we start with primordial follicles. Primordial follicles are formed before birth, and they are the ones that will develop. Several of them in every month will develop into. So here's the primordial. Develop into primary. So primordials just have one layer of cells. And then you're going to have growth of cells, so you're going to have granulosa cells growing around your follicle. So one layer of granulosa cell, that will make the follicle become primary follicle. Now you still have, in the primordial follicle, you have a primary oocyte. In the primary follicle, you will still have a primary oocyte. So here's a primary follicle with primary oocyte. Primary follicle with primary oocyte. The granulosa cells will continue growing, and then you will see the beginning of formation of a fluid-filled space called the antrum. So if you have like two or more than two layers of granulosa cells, you can call it a secondary follicle. And especially if it has an antrum, a small antrum, you can call it a secondary follicle. So here's an example of secondary follicle. Not the best example because you don't see the antrum, but here we're going to call it the secondary follicle.
What's an antrum?
Fluid-filled space.
Is it like this?
I'll show you later. So primordial follicle, primary follicle, secondary follicle. All of these have primary oocytes. Then eventually your antrum's going to be big. Your follicle is going to get huge. You're going to have lots of layers of cells around them. So that follicle will be called Graafian follicle. And Graafian follicle is the follicle that's going to ovulate. So this empty space right here, that's the antrum. And this is the Graafian follicle. And you see it's about to, there's like crack formation in the ovary. But it's about to ovulate. So this right here, the peak in LH will stimulate this Graafian follicle to rupture, and it will stimulate the primary oocyte to be converted into secondary oocyte. So Graafian follicle and ovulated follicle, that's or ovulated oocyte, that's going to be a secondary oocyte. So only in Graafian is secondary, everything else is primary oocyte. And just keep track. That's the secondary follicle with primary oocyte. So remember that before ovulation, you're going to be all primary oocyte, and just keep track of your follicles: primordial, primary, secondary. And when you get to Graafian, that's the one that's about to ovulate.
That's secondary oocyte.
That's going to be secondary oocyte. And then if you see the oocyte being released, it's like hanging around in the body, then that's secondary because it's already been ovulated.
Right.
So after ovulation, you can see the formation of scar tissue that produces progesterone. So this is your corpus luteum. Corpus luteum will be active for about 14 days. It functions to produce progesterone, which you need to build up the uterine lining. After those 14 days, the corpus luteum will degenerate and it will become corpus albicans. And corpus albicans does not produce any hormone, and at the formation of corpus albicans, that will initiate the menses phase of the uterine cycle because there's no hormones there.
Is this
Yeah, that's corpus albicans as well.
Is that corpus luteum?
Yes. That's it for the ovary.
Okay. What is that? Can you please
Corpus luteum.
Yeah, definitely.
Can you have her
Okay.
that?
All right, we're done, guys.